Thank you very much for your willingness to be interviewed today. Again, this is for a Gender and Madness course for Portland State. There's a possibility that we would publish because this will be submitted to one of the psychology peer-reviewed journals.
Okay.
And again, this is regarding 4-point restraints and if and when they're used and when it becomes, or if it becomes, abuse or a civil violation of a person's rights.
Okay.
And it is definitely in your field because we really are covering the psychiatric part of this whole regime.
Okay.
And so Alyssa, go ahead and ask her questions and then we'll just move along.
First of all, if we could start out asking what your position is and how long you've held it, what you're doing.
I'm a staff nurse. They don't have a formal charge position, at least on this unit in this hospital for nights. So we alternate doing charge. So I'm a staff nurse tonight. I happen to be in charge.
And how long have you been a staff nurse?
Here, 6 months. I've been a nurse for 28 or 29 years,
Okay.
and in psychiatry most of that time.
All right. Have you ever restrained a patient, and if so, why?
Many times, for danger to self or others. Sometimes it's self-harm, banging their head against the wall, cutting themselves, and they will not contract for safety. More often they're put on a one-to-one for that, or aggressive behavior, or property damage if they're tearing up the place.
What are your feelings on this? Feel bad doing it? Do you?
I don't like doing it. I mean, that's the last resort. You know, we usually try everything first, everything else that we can, medications, one-to-one, talking to somebody. Sometimes it just blows up too quickly for that. You know, if they take a chair and throw it through the window, you know, you have to get your security people in place and stop it then.
Do you view restraints as necessary, or do you think there are some alternatives?
They are necessary at times. I'd rather try alternatives. I can't imagine what it must feel like to be strapped down in 4-point restraints. And a lot of psych nurses have tried it, but it's got to be scary. You know, whether you're in your right mind or not, even if you are not psychotic, if you're that angry, it's got to be frightening. You know, and a lot of people are frightened of their own anger when it gets to that point.
So what are some of the alternatives that you would try first?
Depends on the situation, but medication certainly. And sometimes with medication you can talk to somebody and get them to contract. You know, we'll give you this medicine to help you calm down. You know, if I just lock this door, you know, can you calm down? You're not going to hurt yourself. You can get them to contract. And sometimes you can't. So medication, one-to-one, often with people who are cutting themselves or hurting themselves, you can put a person with them, put them on one-to-one, and avoid it that way. And sometimes they just need to talk about what's going on, and that helps to calm them down.
How do you feel about the current protocol regarding restraints? Do you feel they're necessary, or they hinder you in any way, or they're helpful?
They can be helpful in helping the patient to calm down, certainly in protecting other patients and staff. So while I don't like to do it, and I'll try anything else that I have available first, I think it's necessary. And you know, the policy is fair because you always have to think of the safety of the unit, not just the staff, but other patients. They could be injured if someone is being violent or aggressive.
Do you think even if you use the protocol correctly and follow the protocol, do you think the restraints can ever be abusive or harmful to the patient or violate their civil rights?
If used properly, I would say most of the time no. Now sometimes, you know, can an injury occur? Yes. But I think if you follow the protocol, you're not going to violate someone's civil rights. Because if you're, for instance, being aggressive, if I let you go, you are impacting the civil rights of every patient in here. So I have their safety to consider too. But, you know, if they're used improperly, yes.
Do you see a difference between the way males versus females are restrained?
I think males are restrained more often because they're more, in my practice, in my years of practice, they've probably been more inclined to get aggressive, but no, I don't think so. I think it's pretty much equal according to the behavior, as far as what I have seen.
Have you noticed different reactions amongst males versus females while being restrained?
I think men are more inclined to get aggressive, but then again, like I said, we've had more males to be restrained. There are women who are just as aggressive and just as hostile at times. We just seem to see more of the men.
Do you view restraints as a last resort or more of a precautionary measure before things escalate?
Last resort. And I think things have tightened up over the years that I've been in practice. I think in the past we've been maybe quicker to use them in the facilities I've seen, and it may depend too on where you're practicing. Are you in a state hospital where you get more of the violent patients, or are you in a community hospital where you see fewer of them, or a private hospital? You have to be very careful to safeguard civil rights, because that's really depriving somebody of their freedom.
Could you go over some of the drawbacks to restraints as you see them, and some of the pros as well?
Well, I mean, I really think it impacts on a person's dignity, and you have to do what you can to try and safeguard that while they're in restraints. You have to explain what you're doing and why. Even if they're screaming and cursing at you, you have to make an attempt to say, you know, when you can control your behavior, we'll start getting you out of these. There can be physical injury. In years past, there were, in some facilities, and it made the journals, people were restrained 2 arms or 2 legs. That's never an option, because that's where you're going to get the greatest potential for injury. It has to be opposite limbs, right arm, left leg, or the other way around. You can't have just 2 arms or 2 legs restrained. You have to always be conscious that they're not too tight, that, you know, you can get a couple fingers in there, check their circulation. You have to take them off, usually, you know, like 10 or 15 minutes every couple of hours, alternately if they're in 4 points, and exercise that limb if that's possible. But, you know, if it's not, there's always a potential for injury. You know, if you don't, you know, move that limb around. And those are the major ones that I can think of. But it's just, it's demoralizing to a person too. Although, as I said, some of them are frightened by their own anger. Did I answer the question completely?
Yeah, I think some of the positive points of it, if there are any, to restraints.
Well, you're going to prevent injury to that person or to others. And we do use them at times for property damage too. And if you're going to use them for any reason, you always want to medicate that person. You want to use what they call a chemical restraint and get them out of physical restraints as soon as possible. Because that, as I said, again, it's frightening, it's demoralizing, it's scary. You're at somebody else's mercy when you can't do anything for yourself.
I think if you want to...
So you were saying that you want to use chemical restraints to get them out of physical restraints.
Mm-hmm.
So you feel that that is an advance, a less aggressive.
Yes, and sometimes you can use those first and get somebody to contract with you. Okay, I'll go in my room and lie down and take a time out and calm down. And sometimes that works. And I've had some patients over the years ask to be secluded, locked in a room. They didn't